So welcome everyone to this webinar where we are going to talk about the dental health science program and the new entry requirements. There are a number of staff online and who will be able to answer your questions if you type them in, and also will be available at the end of the presentation to take any questions. So before we begin, I would like to do acknowledgement of country. Griffith University acknowledges the traditional custodians of the land in which we are meeting and pays respect to the elders past and present, and extends that respect to all Aboriginal and Torres Strait Islander people. So why choose doing dental health science, which is a dentistry, at Griffith University? Why do you want to come and learn under our banner? Well, we've got a very proud tradition of our graduates being work ready on graduation. They're all ready for independent practice. They are registered by the Dental Board of Australia to be able to start working the day after you qualify. So in this program here, you'll be registered as a dentist. As I say, we enjoy a good reputation of our graduates with employment choices, not just within Queensland, but certainly within Australia and also overseas as well. We have a number of students each year who go back to go to places like Canada and up into Asia there for jobs. There are, of course, regulatory requirements in doing that, but the degrees are all accepted as being strong and registrable degrees. Last year, which was a very difficult year for all educators, but we had 80+% of our graduates found employment within 4 months of graduating from the last year cohort, which is exceptional. There's other opportunities to expand your career once you've become a dentist. We have an honours year, which is a research-based year, but you start within the final year of the program, and then you finish it usually in the first year out that you've graduated. You carry on, do another trimester of work, and come out with an honours degree. That is useful if you're planning to specialise or do some more advanced training in the future. And we also have programs as well that are training specialists in dentistry. In the latest quality indicators for learning and teaching, which is a Quilt survey, it's a national survey. It's not run by the university, it's run by the government. In our dentistry program, we were the highest nationally for overall education experience. And this is coming from previous graduate students, so it's their experience. So we're the highest for overall education experience, highest for learning engagement, and also for teaching quality. So I think they're very good indicators of the quality of the program. We're also ranked #1 in the Good Universities Guide for Australia of all the dental schools in Australia, where we've been ranked #1. And we're highly ranked in the Shanghai Rankings Global Ranking of Academic Subjects, and the latest one was 2020. We are, as in Melbourne, we're equal in that ranking, in that Shanghai ranking, which is a very important ranking that all universities take notice of. So we're equal with Melbourne. Why else come see us and train with us? We've got a very good facility with our clinical training. So this image here is of the G40, the Ian O'Connor building which houses dentistry. We have a clinic on it's called the third floor, but it's the ground floor as you look from here down to the left. We have 96 chairs in that clinic, and that's where you do the bulk of the clinical training. We above that, a couple of floors above that, we have preclinical simulation laboratories where you learn all the procedures before you head on to managing patients. We see over 1,000 patients a week in that clinic, and we serve the Gold Coast population to a very high degree. So the Bachelor of Dental Health Science is a 3-year full-time degree, and it's on G40 there on the Gold Coast campus is where you do most of your dentistry teaching. We will obviously use other areas when we're looking at medical science subjects as well, but they're all on the Gold Coast, so everything's on the Gold Coast campus. We have we try and make sure that our clinical training and all our practical elements are well integrated into your didactic learning. So that's all meshed horizontally and vertically together to produce a very contemporary curriculum. All our practitioners you'll find in the clinical teaching are all registered practitioners. We have quite a number of dental specialties represented in the teaching staff, which add to the level of education. In that clinic in G40, as I mentioned, we see about 1,000 patients a week, but we actually produce over 120,000 occasions of service to patients per year. So that's 120,000 procedures per year, and that is it's the highest you can get around the place. No one else in the state that reaches that sort of numbers. Yeah. So the Bachelor of Dental Health Science, again, it's a 3-year program. It's one of our graduates there who wasn't not too long ago. He was with us and now is graduated. It's a 3-year program. Now, the 3 years doesn't make you a dentist. Okay, so after you complete the 3 years, you then seamlessly move into a 2-year Master of Dentistry program. Okay? So that's the final 2 years of a 5-year dentistry program. In year 1 of the Bachelor of Dental Health Science, which is the first year of the whole 5 years, it's primarily didactic education with a lot of the medical science and the oral biology and some communication skills, which underpin the dental practice, the areas that you need to know as we move through with more advanced aspects of your education. We also get you to do a little bit of work on a 3D virtual realist haptic simulator. It's 3D, it's virtual, and you get to do that on in the first year. You get to get an introduction with hand instrumentation in dentistry, how to cut shapes and produce procedures is all introduced there in that first year. Year 2 is when we get into a lot more of the dental specific subjects. There will still be some basic science subjects in there to finish off. But this time, it's year 2, you're going to get introduced to the bread and butter, so to speak, of dentistry. So you're going to get karyology. Karyology is tooth decay. We're going to get into learning that. We're going to learn how to prevent prevention of disease. We're going to learn our operative procedures. So we're going to learn the theory of operative procedures, but we're also going to be going into the preclinical simulation laboratory and learning those procedures on mannequins and how you actually do a certain procedure to meet, and it's mainly to treat caries and karyology. That is to get ready before you go in to see patients, and you start to see patients in the 3rd year. of the program. Again, there's still a lot of didactic education in that third year, catching up with other subjects. But you start to get introduced into the clinic in third year. It's into the areas that you've already been taught in that second year. So it's a lot of prevention, understanding of prevention and for patients, but also starting to do some operative procedures as well for patients. That then gets you all set up for the last 2 years of the program. So you go into the third year, fourth year of the program, the first year of the master's degree, and it's a very heavy clinical year. And the final year is a very, very heavy clinical year as well. And then you graduate. So the Bachelor of Dental Health Science is it's a bachelor's degree, so it's an AQF level 7. But the Master of Dentistry degree is an AQF level 9, and that is equivalent. That is the highest level that you can get a dental degree qualification at. A basic dental degree qualification is level 9. And so that is equivalent to our colleagues in University of Sydney, Melbourne, Adelaide, Western Australia, who have graduate entry programs, and they're a 4-year program because they're graduate entry, but the level of the qualification is exactly the same. So AQF level 9. It's the highest level you can get. So with that level, it means that you have to understand complex procedures, complex degree of knowledge, and also be able to have some degree of research literacy as well. So we're here to talk about the new admissions process, and we designed this process to give a bit of diversity to what for candidates applying into dentistry, so that we're able to pick up all more rounded skills with everyone rather than relying on just one type of entry requirement. This is the basic tenet in how you apply. There's 3 areas that we'll talk about. We're going to talk about sitting the UCAT, it's the Universal Clinical Aptitude Test, applying through QTAC, and then we're going to do multiple mini interviews. Now, Janine, are you online there to talk to this slide?
Yes, Robert, I'm all organised, thank you. So yes, my name's Janine Wells and I'm the Medical Selections Officer here at Griffith, and I answer the complex inquiries about the Doctor of Medicine as well as the Bachelor of Dental Health Science. And Leo did just ask very quickly if that people are guaranteed to move from the Bachelor of Dental Health Science into the Master of Dentistry, and I'll just pop that one in there. Yes, Leo, graduates are guaranteed to move forward from the undergraduate degree into the postgraduate qualification. But talking about the new 3-step process for admission into the Bachelor of Dental Health Science, this process starts for applicants applying for 2022, and it starts with sitting the UCAT. Now, this is the ANZ version, Australia and New Zealand version of UCAT, but if you put UCAT into Google, that's the version you will come up with. The next step is, just as you would have done in previous years, is to apply via QTAC to ask for a place in the Bachelor of Dental Health Science at Griffith. And the third step, which is the second new step in the process, is to participate in a Griffith multiple mini interview, an MMI we call it. So bookings to sit UCAT ANZ are now open, which is why we're holding this webinar now. They opened at the beginning of March and they close on the 17th of May 2021. The actual UCAT exam runs in sessions across July through to the 11th of August. So when you register to sit for an exam sometime during that period. There are multiple opportunities, but you may only sit the exam once and get one result. If you do try to resit, those results from your resit will not be used for your application. UCAT won't verify them. applications for the Bachelor of Dental Health Science, so not all QTAC applications, but the QTAC applications for the Bachelor of Dental Health Science will now close on the 30th of September 2021. So this is much earlier than it has been in previous years. It was the end of December previously. We need you to have your applications in by that date, because we need time to actually hold the multiple mini interviews, the MMIs, in November. And the scheduled dates for that at the moment is the 25th or the 26th of November. There will be more than one session, so we do require 2 days. So what's UCAT? Those of you who are at school still probably have heard of UCAT, because UCAT is a computer-based test that is used by a lot of different universities already for admissions to their various undergraduate qualifications in medical science and dentistry. It's a computer-based test, and a lot of high schools do prepare their students already for the UCAT. Year 11 students can't sit UCAT. You have to be in your final year of school. For a New Zealand school leaver, that would be your year 13, not year 12. And obviously, once you've left school, you're able to sit UCAT. There are 5 sections to the test, and you can find a lot of information about the UCAT at ucat.edu.au. Strongly encourage you to go and have a look at that site. There is free test preparation information there, and the underlying recommendation is practice, practice, practice. Get a good feel for how the test goes to pace yourself through the test. The MMI, and Robert, did you want to talk to this slide? No, I've lost Robert. Okay, so the MMI is based on the format that we actually hold for our multiple mini interviews for the Doctor of Medicine. So there'll be 5 questions. And what they'll be looking to explore is your motivation to become a dentist, teamwork, communication and empathy, ethics and social awareness, and your critical thinking. Each question will have the same value, and you'll have 5 minutes to go through that particular question before you move on to another station. As I say, very similar to the process that we undertake for our... Sorry, you're there, Robert.
Sorry, Janine. Yeah. Hope you can hear me. I'm having trouble hearing you, Janine. But I think you asked me if I want to talk about the MMI.
This slide. Yep.
Yeah. Okay. So the multi-mini interview questions there. We're going to be looking at 5 aspects of it. These are all areas that are recognised within dental education as being important to identify. They're innate traits. They're not necessarily taught traits, so they're innate traits. And so we're going to ask some questions around those 5 areas of motivation for dentistry, teamwork, communication and empathy, ethics and social awareness, and critical thinking. Now, with these questions, there is actually no right or wrong answer. It's all about how you answer them. There's no, so when you're talking to the staff, they're not sitting there with a right answer. There's no right or wrong answer. It's just how you answer the question, whether it's directed towards where the question is coming from. But as I say, they're not sitting there expecting to have a right or wrong, a right answer there. All questions are the same value, and essentially we're just looking at talking for about 5 minutes. Well, you talking to 5 minutes on the question, and then a bit of time to move between stations. There'll always be 2 calibrated assessors there, so there's always 2. And they'll do a bit of a marking afterwards on how the questions have been answered using a rubric that everyone has to use exactly the same. If the two assessors do not come to an agreement on what they felt they'd heard, then there's a senior person who would come in and look at the notes that the assessors have made and then make a determination. And and that determination may be that you will be able to get another opportunity to answer one of the MMIs there. So it's all a degree of openness and fairness where everything's designed. As I say, there's no right or wrong answer for the questions. Shall we move on to the next slide?
Yeah, thank you, Robert. Yeah, so your actual admission ranks, so up until 2022, to be offered a place in the Bachelor of Dental Health Science at Griffith, offers were made based on your academic achievement only. So as many of you will know, this meant that you did need to achieve a high ATAR or a high GPA to be made an offer into the program. With the applicants from 2022, because we now have a three-step process, your actual admission rank is going to be based on 20% of your UCAT score, 40% of your MMI score, and 40% of your academic result. Because of the timeline that's involved, it's actually going to be your UCAT score which will give us an indication that you should be invited to interview for the MMI. So you'll sit UCAT, and I've got a timeline slide to show you. You'll sit the UCAT and you'll get your score from the UCAT. You'll then be, based on the basis of that score, be invited to the MMI that Robert has just described to you. And after we have your UCAT score and your MMI score, we'll then await, for school leavers in particular, we'll await your ATAR results. For university students, we'll be getting your GPA. For those of you who have already graduated, we'll have your GPA. It'll all be there in your QTAC application, and we will put them together in this combination: 20% UCAT, 40% MMI, 40% academic results, and we will then make offers just as we've done in the past based only on academic results. We'll now be making offers from the highest admission rank through to fill the number of places that we need to fill for the Bachelor of Medical Science, for the Bachelor of Dental Health Science. So the actual timeline which I particularly wanted to share with you is that, as I said, the application process has actually started already for 2022. So from the beginning of this year, applicants will be preparing to sit UCAT. As of the 1st of March and now through to the 17th of May, you'll be applying to sit UCAT. Sometime in July through to the 11th of August, you will book a session to sit UCAT. Then the QTAC applications for all applicants for 2022 will open on the 2nd of August. And those students who are applying for the Bachelor of Dental Health Science, you must have that in your application, so in as one of your preferences, by the 30th of September 2021. Now, this doesn't mean that you can't change your preferences or you can't add other preferences, but you must have the Bachelor of Dental Health Science as a preference in your QTAC application by the 30th of September, and you won't be able to add that as a preference after that date. If you withdraw that as a preference at a later stage, you won't be able to be made an offer into the Bachelor of Dental Health Science, because you will no longer have that program as a preference. So the applications for Dental Health Science and QTAC close on the 30th of September. We will be sending out the invitations to the mini multiple interviews sometime late October. At this stage, I'm anticipating that QTAC will be able to send those invitations out on our behalf, but still not 100% sure about that. So you should keep your email addresses up to date in QTAC and be keeping and checking in your junk mail. That's often an issue we have. If you're still at school, are you using a school email, or is there another email that you can use? So I've just been told that Robert can't hear me. I'm assuming that everybody else can hear me. So the MMIs will then be held on those dates that I mentioned in November, which is the 25th and 26th of November at this stage, and planning on scheduling 4 sessions, 2 on each of those days. But again, it will depend on how many applicants we actually invite to interview. And then it's the wait. And people say, why do we have to wait so long? Well, again, we've got to collate all this information. We've got to wait for the Year 12 results, which won't come out until that week just before Christmas. So the offer round for the Bachelor of Dental Health Science is actually next year. It'll be on the 13th of January 2022. So it's a long process, I know, but that's why we're having this session now, to make sure that you're fully across the actual timeline for the applications. The next slide I'm putting up is going to have an email address on it that you can send complex inquiries to. So straightforward inquiries can be sent to our future students at griffith.edu.au inquiry. Inquiries about the content of the Bachelor of Dental Health Science would be handled by the School of Dentistry and Oral Health. But for questions about complex admissions to the Bachelor of Dental Health Science, and I'm seeing a few of them popping up there. I've already got a degree, and yeah, I'm doing postgraduate study, all those sorts of things. Happy for those inquiries to come through to medicine@griffith.edu.au. That's the email address that I use to answer the medicine, dentistry and dental health science questions. So that's the end of my part of the session, and I believe that Lisa is now going to moderate a Q&A session for you.
Thanks, Janine. Can you hear me?
I can hear you fine, Lisa.
Lovely. Richard and I are going to play a bit of tag team on this session. I've just popped up a reminder for everyone that if they have any complex admission queries, to email Janine at medicine@griffiths.edu.au. I'm just going to scroll through to see if there's any of the questions that have popped up that we may not have answered.
I can see a couple there that I can answer if I can, Lisa. One of them was if your UCAT score isn't high enough in 2022 or for 2022, do you have to resit? Yes, unlike GAMSAT, your UCAT results are only valid for 1 year. So if you sit in 2021 for admission in 2022 and your results aren't high enough, then you will have to resit to apply for 2023. And somebody else has asked, if I sit GAMSAT, do I have to sit UCAT? Yes, you do. GAMSAT is actually a graduate entry exam. UCAT is for undergraduate programs, and our Bachelor of Dental Health Science is an undergraduate program.
Janine, we have a question from Rowan. Rowan's asking, will there be an opportunity to include dental industry work experience, e.g. 3 years dental assisting, and various reference letters from dental professionals as part of an application to study dentistry?
No, No, Griffith doesn't accept portfolios or references or those sorts of documents as part of the application process, but that's what the MMI will be about. That's why we've introduced the MMI, and if Robert's back on online, I'm sure he'd probably explain. Part of it is about your opportunity to explain. One of the questions is why you want to be a dentist, how enthusiastic about being a dentist you are, or we get questions from dental hygienists and people like that. So no, we don't expect documents, but yes, you can put that information forward as part of your interview.
And Janine, we have a question from Hayden, who's asking for a friend. Do international students need to sit the UCAT as well?
Do which students, sorry, you dropped out for a moment, need to sit UCAT?
International students, sorry Janine.
The application process for international students hasn't changed at this stage, and I'm only dealing with domestic students. But that's not to say that it won't change in the future, and if Robert's back online, Robert might be able to respond further to that one. If not, send me an inquiry at themedicine@griffith.edu email and I'll follow up on that question for you.
Janine, can I just, sorry, it's Richard here, just to confirm that, to confirm what you said is exactly right. We're not applying the new process to international students at the moment for 2021 entry anyway.
2022. We're in 2022.
That's exactly right. Yeah, I'm behind the times. Apologies, everybody. Yeah, 2022. Yeah. Thank
Janine, we have a query from Kenneth in relation to rural applicants, and the question is there a certain amount of places allocated for rural applicants?
Yes, we do have a rural quota, although, and that's set by outside Griffith University, and we will be ensuring that we interview enough rural applicants to give us an applicant pool for rural students. I'm seeing there how many places will be given to non-school leavers. We don't actually have a quota for school leavers or non-school leavers. We have a place, we have 80 domestic places in the Bachelor of Dental Health Science, and they will be allocated, as I said, from highest to lowest based on your admission rank, which will be calculated across the UCAT, the MMI, and either your GPA or your ATAR. There's another one, how many places are safe for postgraduate? No, there are no places safe for postgraduate applicants. There's not a postgraduate pathway, and even with a GPA of 7, that particular applicant, Sandeep, you would have to apply, sit the UCAT, pass through the MMI, and then your GPA would be added to your UCAT and your MMI.
Janine, we're getting some recurring questions around what percentage is needed from the UCAT to be offered an MMI.
We really have no idea at this stage because this is the first year of the process. So they'll need 20% of their UCAT score to go into their admission rank. But what UCAT score they will need, we know that we'll need an applicant pool to interview, and we will certainly set a point at which we will probably fail applicants. But again, it's really just our first UCAT, and we need to look at it.
Can I just come in there, Janine? I just wanted to add that, which is sort of stating the obvious, but of course dentistry is a very desirable program to get into, and therefore entry is always highly competitive. So I think the best advice one can give to any of the potential applicants is to get the best possible score that they can, to give them the best possible chance.
And as I said, use the practice material on the UCAT site. Practice, practice, practice. I heard a very interesting talk at one of the local schools from a woman who came in via into an undergraduate medical program, so she sat UCAT, and she said that she went through a practice UCAT test at least 3 times a week, preparing herself, and that she actually found some of the questions in the practice tests came up during the live exam. So it held her in good stead. I'm just looking. So 80 places are given to domestic students. How many applicants will be invited to the MMI? We think probably around 200 to 250. The issue will be where you preference the Bachelor of Dental Health Science on your QTAC application. You may be invited to an MMI, but if you have the Bachelor of Dental Health Science as your second or third preference on your QTAC application, you may be offered a higher preference. So we have to ensure that we interview sufficient applicants to ensure that we are able to have 80 places filled. Someone's asked how many rural places. Our quota for rural places last year, and I'm sorry, I'm really digging back in my memory, was six or seven. Sorry, I'd have to double check my notes. I know it has been 10 in previous years. Somebody else has said, can I sit UCAT at Griffith? No. The UCAT exam is actually sat at UCAT testing centres, and all that information is available on the UCAT site.
Janine, we have a question relating to how many international student places did we offer?
I think it's 20, but Richard might be able to confirm that.
Yes, sorry, Janine. Yes, yeah, 20 is the quota for internationals for dentistry. Yeah.
We have a question from Samir and Janine. I've applied twice and my degrees are from overseas as well as my high school diploma. What's confusing is that my ATAR came back different for both years, yet my degrees and grades haven't changed. Is there a reason for that? My ATAR was in the 99s, but the decimal points varied from one year to another.
Without seeing the actual specific details, I can't respond to that. There are conversion tables from GPAs to ATARs and OPs, and there may and has been in the past slight fractional differences, but I'd have to actually see the actual QTAC applications to have a look at that, and that shouldn't make as much difference with this now 3-step process.
Janine, we have a question from Daniel. He holds a bachelor's degree done overseas but is applying as a domestic student as he's a permanent resident. Does he still need to sit UCAT?
Everybody applying as a domestic student needs to sit UCAT. No exceptions. No one will be able to be made an offer into the Bachelor of Dental Health Science as a domestic student without sitting UCAT. Someone said, what is the minimum GPA required if you do an excellent UCAT and MMI? Again, we really aren't able to give you a specific answer to this because this is the first year. I would expect that it would still be in the mid to high 90s, but again, it's a matter of us doing those calculations and making sure that we have sufficient applicants, first of all, in the applicant pool for the MMI. So that will be based on your UCAT score. If you do well in the MMI, then just like it does in other programs, a high UCAT and a high MMI will offset a lower GPA or ATAR, and vice versa. A strong GPA or ATAR is going to offset a weaker, for want of a better word, which they're not. You all do exceptionally well. I'm sure that every one of you has done much, much better in your studies than I ever did. But it can be offset. A high GPA or ATAR can offset a UCAT or a MMI that's not quite as strong, but there will be a fail point for the UCAT and the MMI. We just haven't established what they might be yet. It will be a matter of seeing the first year applicant pool.
Janine, we have a question from H, and this relates to Indigenous applicants. It relates to whether UQ does or doesn't require Indigenous students to sit UCAT. So do we have a response to?
We cannot. We can't answer any questions about other universities, so I don't know what the requirements are for UQ. And at this stage, we haven't changed the pathway for our Indigenous applicants. So at this stage, a Indigenous applicant would have to sit UCAT just as an Indigenous applicant for the Bachelor for the Doctor of Medical Science has to sit GAMSAT.
Sorry, Janine, just to interrupt again, I think we've got Robert back now as well. So just to share the burden a little bit. After your sterling work. I don't know if Robert's able to hear us and join us yet.
No.
Maybe not.
Janine, I might just ask a question if I can jump in. Arushi has asked and reposted, will leeway be given for rural students in regards to the UCAT score and GPA?
Okay, we may go to a lower UCAT score to ensure that we have sufficient rural applicants in our interview pool for the MMI. So it may be that there will be a lower minimum for rural applicants, just to make sure that we do have them in the applicant pool. And again, similar to what happens with our rural applicants for the Doctor of Medicine. So the cutoff point has been lower for rural applicants. So we will go lower for rural to ensure that we do have sufficient rural applicants in the MMI interview pool. But once we actually go into the amalgamation of the MMI, the UCAT score and GPA, at this stage, I don't believe we will have a lower admission rank for a rural applicant. But again, we are looking to meet our quota.
Hi, Janine. I think I'm back.
Okay.
Okay.
You're back, Robert.
Yes, I can hear you.
Yeah, but I don't think the video is working either. But
right. Oh no, I can see you, Robert, down in the corner of my screen.
Okay. Thanks.
Yeah, it looks like it is working, Robert. You're here and audible. So.
Okay. Sorry about that, everyone. Thank you. Thanks, Janine.
Yeah. There's a question there, Robert, about graduating from the Bachelor of Dental Health Science, guaranteeing a place in the Master of Dentistry, and that's correct. Only graduates of the Griffith Bachelor of Dental Health Science are accepted into the Master of Dentistry at Griffith. So there won't be people transferring from other universities or applying from other universities, only our graduates from the Bachelor of Dental Health Science.
Yep, that's correct. It's a seamless transition into the Masters of Dentistry, but it is only our graduate.
We have a question from Claudia, regarding the MMIs, which we've indicated that at this stage we anticipate would be face-to-face. But Claudia's wondering, what if you live interstate? How would we accommodate candidates from interstate for an MMI?
Normally we would expect the candidates to travel for a face-to-face interview. So at the stage we are planning for face-to-face, but we will have contingencies in case borders get closed down with COVID. But the expectation is that people would travel to the interview.
I just see here that Emily's asked if she'll know her selection rank after the interview. No, Emily, you won't. What you will know is your rank as it's calculated when you look at your QTAC application. It'll then be up to Robert and his team whether after that, if you're unsuccessful in being made an offer, if they'll be providing any feedback about MMI performance, and that's not something that I've discussed with Robert, so he might want to comment.
Yes, selection ranks probably won't be available now. Next question is how many MI stations are Lisa's answer that. There's 5 stations, and I think the slide on the screen there shows you what the 5 stations will be.
Someone's asking about gives you a higher chance of getting an MMI. No, that's not correct. What I was saying is because the only thing that we will use to decide whether or not you will be invited to an MMI will be your UCAT score and the fact that you have the Griffith Bachelor of Dental Health Science as a preference. What I was saying was that we need to interview sufficient applicants so that if you have another program at another institution as a higher preference than our Bachelor of Dental Health Science, then obviously we're not going to be able to make you an offer if you get an offer to that higher preference. So we just have to make sure that we're not going to interview just first preference applicants, but if we interview you and we're your 6th preference, then it may well be that you get your 1st, 2nd, 3rd, 4th or 5th preference. So we just have to make sure that we actually interview enough people. That's all I'm saying. We are not requiring you to have the Bachelor of Dental Health Science as your first preference. However, we do require that you do have the Bachelor of Dental Health Science as a preference in your QTAC application, and it remains in your QTAC application right through until the offers on the 13th of January. Any other questions, Lisa?
We have a question from Rachel. Is there any particular preference to accept those with an existing Bachelor of Oral Health degree with extensive experience?
No. As I said, it's a 3-step process. Obviously, someone with an existing Bachelor of Oral Health Science has a passion to be a dentist, and I'm sure that would be reflected in their MMI, and I'm sure Robert would agree with that. And their experience would also be reflected in their MMI, but they would still have to sit the UCAT, meet the appropriate score, and have the appropriate academic qualification. I don't know if you want to add anything to that, Robert?
No, that's exactly right, Janine. So that's one of the reasons why we'll onto an MMI, is to be able to pick up that those other extra life experiences that applicants may have.
And there's also a question there, Robert, about people who've completed a health science degree, and there is some overlap in the courses, so they're asking whether they'd have to repeat some of those subjects. I know that's not the case, but again, you might want to comment.
No, so Griffith has a credit policy. If you have sat and passed equivalent courses, then you can apply for credit, and then the course convener will look to that and map to see whether it actually meets all the learning objectives of the Griffith course. If it does, then you will be given credit. But that doesn't hold with dentistry courses. So there's no credit on dentistry courses because they're very specific to what we do, but it will apply to medical science courses, biochemistry, microbiology, and those things.
Janine, we have a question from Aditi. How many applicants are there usually per year for this?
For this course, let me grab my little special bit of paper here. I can tell you last year we had 1,355 applicants for 80 places, and of those 491 applicants had an ATAR or a GPA rank of 99 or higher. It's a very popular program, but again, that's why we're introducing, or Robert's explained, it's not just about your academic achievement. Your invitation to the MMI will be based on your UCAT score.
So, Janine, we have a question from Sean, and this follows on to from your last point. Oh, and I've just lost it. If someone holds a bachelor's degree with first class honours, will this contribute to receiving an MMI, or is the invitation solely based on doing well in the UCAT?
No, it's just the UCAT, and I think Robert was going to add something about the MMI and experience in there again.
Yeah. So to answer that question, it's the UCAT that we're using to get the MMI stage. The bachelor degree that works into the GPA, the UCAT score. So you have to sit the UCAT. There's a quick question there about what time frame credit awarded. So you can only apply for credit when you get into a program. So as soon as you're in the program, then you can apply for credit, and then it often take maybe a couple of weeks for that credit to come through if it's going to be awarded.
Robert, it may actually, oh, sorry, Janine. I think that question might also be related to how far back would the study go to be recognised?
Yeah, there is. Sorry, yes, there is also time frame on how long ago that you did the program. Certainly, universities, anything over 10 years is pretty much not recognised to be available for credit because the amount of changes that would have happened in those periods of time. But there is a time limit. Some of that, but also that's also based on the discipline as well, and how far that has moved in the various time. So yes, there is a time limit. Again, when you apply for credit, you'll be asked, what date you're when you completed the program, the course.
There's a question there, Lisa, about if someone's not able to get in through the three-step process, can they transfer in? No, there are no transfers into the Bachelor of Dental Health Science. All applications must come through QTAC, and they then go through the three-step process. So the study that they've done in another science degree can be the GPA score used as part of the three-tier process, but they won't be invited to an interview unless they sit UCAT, and they won't be made an offer into the program unless they go through the three-step process.
Zay's made a question about my ATAR is 0.1 off. Can I still apply? Yes, you can apply. Again, this process is not being completely driven by ATAR. That's why we have the three-step approach there. So you can.
And there's not an ATAR to be 0.1 off anymore. Last year's ATAR is not reflective of applying this year, because last year it was just an ATAR for admission in 2021. So an ATAR that was not competitive in 2021 could be competitive for 2022, but you will need to sit the UCAT and have your interview first.
Janine, we have a question for Sunny, and I believe Sunny may have popped it up a few times and we've missed it. Can you still accept the offer for dentistry if you have accepted an offer into dentistry or medicine at another university commencing in 2022?
The offer, it's up to that other university. If they have a place at another university that they have deferred, then there is nothing to stop that person applying through QTAC and being made an offer by Griffith. They will have to discuss and organise that with the other offer that they have previously accepted. What they do need to think about is that, are they holding out another applicant from possibly being able to start that study?
We've got a really good question from Samia. In Canada, there's a dental aptitude test which is similar to the MCAT. Just reading up on UCAT, is it similar to the MCAT in terms of the mix of science and mathematical questions, or is it purely an aptitude test?
So it's purely an aptitude test based on, again, as I mentioned, innate skills, abilities that you've got. So it's not like the dental aptitude test at all. It's not scientifically based, so to speak, the way the DAT is. Technically, I know the Canadian system really well. Technically, the DAT doesn't actually, it's not a great strong predictor of your success within dentistry, but the UCAT is probably the best predictor of your ability, your success at university. So the UCAT, again, it's innate knowledge, innate skills that we're looking for. So the question there about doing oral health at Griffith, so the dental subjects will not be the same in the dentistry program compared to the other oral health program you may have done, Bachelor of Oral Health and dental technology or prosthetics or hygiene. The courses are quite distinctly different, so we no credit for that.
Robert, we have a question about progression and retention from Mandy. Is the failure rate of the program high? Approximately how many students drop out of the program each year?
The failure rate is not high, and the dropout rate is not high at all. We may get 1 or 2 students a year that may need to do some additional work to progress into the next year, but there's only a small number of students there. Again, the retention rate as well. No, there's not many students who will leave the program.
I think perhaps we're into the last couple of minutes of the session, I believe. I don't know if there are any more questions people would like to post.
Yeah, so there's some questions there about the UCAT. So I would encourage you to go to that site. So Lisa has popped up the site again. We've had it on the slides today to just check out all the details there. There's a question there about being time limited. They are time limited, but I think you should look at the exact details that come up on the site for those things. Again, the testing centre, you'll see when you go into the website, it'll tell you whereabouts the various centres are in Australia, and there are a few overseas as well.
Yeah, and the results are only valid for 1 year.
Yeah, it's
so
1 year.
Yeah, but there's a lot of useful information on the UCAT site, and all their preparation material is free. And yeah, thank you. The medicine@griffith.edu.au email is for complex inquiries about admissions to the Bachelor of Dental Health Science, just for general everyday garden questions, I suppose you can call them. You can email future students at griffith.edu.au, and Robert and the staff in the School of Dentistry are available to answer questions about the content of the program.
Thanks, Janine. I thought just one more mention about the UCAT. It's not unique to Griffith. It's extensively used in Australia in both medical and dental schools. Graduate schools tend to use what's called GAMSAT. It's a similar sort of thing, but UCAT is more designed for our types of schools. So if you're applying for another dental school in Australia, you're very likely to having to sit UCAT as well. So it's the standard.
I think that might be the end of the session. So thank you very much, Robert, and thank you, Janine, for managing so well, and most of all, thank you everybody for attending. And I hope you've got the information, at least some information that you need, and that you'll be ready to apply for entry next year. And don't forget the email, which Lisa's posted up and is on the slide now, medicine@griffith.edu.au. Thank you.